The fetal circulation system is distinctly different from adult circulation. This intricate system allows the fetus to receive oxygenated blood and nutrients from the placenta. It is made up of the blood vessels in the placenta and the umbilical cord, which contains 2 umbilical arteries and 1 umbilical vein. Fetal circulation bypasses the lungs via a shunt called the ductus arteriosus. The liver is also bypassed through the ductus venosus, and blood can travel from the right atrium to the left atrium through the foramen oval. The normal fetal heart rate ranges between 110 and 160 beats per minute. Compared to adults, fetuses have decreased ventricular filling and reduced contractility. Fetal circulation undergoes a rapid transition after birth to accommodate life outside the womb. The placenta connects the maternal and fetal circulatory systems, providing oxygen and nutrients from the mother to the growing fetus. It also removes metabolic wastes and carbon dioxide from the fetus through the blood vessels in the umbilical cord. The umbilical cord develops from the placenta and attaches to the fetus. Oxygenated blood from the mother supplies the placenta, where the placental membrane allows exchange of gases and nutrients. Fetal blood flows through the umbilical vein and is partially distributed to the fetal hepatic circulation, but most of it enters the inferior vena cava, bypassing the liver via the ductus venosus. This blood has an estimated oxygen saturation of 70 to 80%. From the inferior vena cava, blood travels into the right atrium of the heart, where it is directed across a shunt into the left atrium. Because the right atrial pressure is higher than the left atrial pressure in fetal circulation, most of the oxygenated blood is shunted through the foramen oval. A mixture of oxygenated blood from the inferior vena cava and deoxygenated blood from the superior vena cava produces partially oxygenated blood in the right atrium. As a result, the estimated oxygen saturation in the left atrium is 65%, while the right atrium has only 55%. Once the oxygenated blood reaches the left atrium, it flows through the left ventricle into the coronary arteries and the aorta. The aorta branches to supply the brain with the most oxygenated blood. A shunt from the pulmonary artery, called the ductus arteriosus, allows partially oxygenated blood to combine with systemic blood, which then circulates with an estimated oxygen saturation of 60%. The partially oxygenated blood in the right atrium can also enter the right ventricle and then the pulmonary artery. Because the lungs have high resistance to blood flow, this blood is shunted from the pulmonary artery into the aorta via the ductus arteriosus, bypassing the lungs. Finally, blood enters the systemic circulation, and the deoxygenated blood, with an estimated oxygen saturation of 40%, is returned to the placenta through the umbilical arteries to be oxygenated again by the mother.